Good morning, everyone. I am Adrienne Selvage. I work at the Oklahoma Insurance Department. I'm part of the Communications Division. Good morning. Thank you for joining us. I've got my teammate Ophelia that might jump in at the end and help with questions. If you have any questions, be sure to put them in chat. We'll be happy to get to those at the end. I want to mention that during this webinar, you're going to be able to see and hear Rebecca and I, but you will not see or hear yourself. But we will take any questions that you have in the chat box at the bottom. Now, let me introduce our speaker. Rebecca Ross is the agency liaison at the Oklahoma Insurance Department. In this role, Rebecca serves as the information, education, and direct response resource for the industry, small business, and community and consumers. Rebecca has more than 30 plus years experience and provides leadership to the industry and community. Rebecca, thank you for joining us today.
Thank you.
We are thrilled to have you and get to all these questions. We're going to start off with just a real basic one. The federal government has opened the Affordable Care Act exchange. It is open to individuals who are residing in Oklahoma who want insurance, maybe missed the opportunity previously due to the COVID-19 pandemic. This is considered a special enrollment period. We'll sometimes refer to that as a SEP. It began February 15, it runs through May 15. And just to kind of kick us off, who can apply during this SEP?
Anyone who wants health insurance now for whatever reasons. It may be that you never had coverage to begin with and you want coverage now, or you have COBRA and it's too expensive and you want to look at other options, or if you have another type of individual policy that is not working for you. These are all reasons that you can come into this COVID-19 relief SEP. So it's a come all event.
So if someone just lost their job and their health coverage, does this SEP help them?
Yes, it does. And if you've lost your job, depending on the company that you worked for, they may have offered you a severance package. And if they did, you want to look at that and understand what's in it as far as your benefits and the commitment that is made. Or, you know, your COBRA could be paid by your employer in that severance package. So that's something that you want to understand thoroughly. But if you have to pay for COBRA yourself and it's too costly or it's not even offered, then you can apply during this SEP as well. If you have a spouse who is covered through their employer, you may be eligible to apply through your spouse's plan, but there is a time or a window for you to do this. So if you've exceeded that window, then you can come into this special enrollment period. And also, if you're under the age of 26 and one of your parents has group insurance, you could feasibly come under their plan. You don't have to be single. You don't have to be in college or a university. So you could come under their plan, but again, there is a time frame for you to enroll under your parents' plan. So if you have exceeded that, then this is the special enrollment period that you can come into the marketplace and have coverage on your own.
If someone is under the age of 26 but married with children, this how does that work with their children or spouse?
Well, it would only cover the adult, that is the adult child of the parent's plan. It won't cover the spouse or the children. You would have to buy insurance separately for them. So it would just cover the child, the adult child or the dependent of the parents.
Okay. What if somebody has low income or no income? Are they still eligible to apply on the exchange?
Maybe, but apply anyway. That's going to be your best guide. So you want to list all your taxable dependents and all income sources. that whether you want coverage for yourself only or everybody in your family. List all of your taxable dependents and all your sources of income. Answer all the questions that's on the application. That way you can determine where you stand. If you're eligible for a plan on the exchange, then once you've made the application, then it will show you the plans available to you and all the premium assistance that you're eligible for. But if you are not eligible for an ACA compliant plan, you could be eligible for Sooner Care or Medicaid. And you would be auto-directed to that program's website. Another option that you can consider is Insure Oklahoma Individual Plan. You can visit that at insureoklahoma.org. And that is health care coverage that's offered through the state. It's not insurance, but it certainly is an option for you. Premiums are very low, if any, and out-of-pocket costs are very low, or if any. So you'll want to check out that plan. But keep in mind that Oklahoma is going to expand Medicaid or expand Sooner Care effective July 1 of 2021. So you can visit okhca.org to find out more information about that program.
So when you say they're going to expand Sooner Care, you're saying with the new adult category?
Yes, they're going to allow adults into the program that are under 138% of federal poverty level. So those people that are enrolled in the Insure Oklahoma individual plan will automatically be enrolled in the expanded adult, new adult category of Sooner Care. So it's going to open up opportunities for more people to come into the Sooner Care plan. So that is that program will launch July 1st of 2021.
Fantastic. What about people with medical conditions? Can they still apply?
That's the perfect scenario for the ACA plans on the exchange. The ACA carriers cannot ask health questions or apply pre-existing condition waiting periods. They cannot deny coverage due to your health. They can only deny coverage due to fraud or non-payment of premiums. So this is come as you are application website. So keep that in mind as well.
Why would somebody want to buy coverage off of the exchange?
Well, the first thing is to see if they are eligible for premium assistance or subsidies. That's usually the driver, and that's what could eliminate your premiums or substantially reduce your premium. And it could also eliminate or reduce your out-of-pocket expenses, such as your deductibles, coinsurance, and copayments. To Sooner Care, which is the Medicaid program for Oklahoma. So you can go that way. Another option is Insure Oklahoma individual plan. If you're interested in that option, you'll want to go to insureoklahoma.org. It will have the list of providers that you can research or look at. It will have the application for you to apply. So if you do that, that will be great. That is Oklahoma's own insurance plan. Well, it's not really insurance, but it's healthcare options plan designed by Oklahomans for Oklahomans. And so check that plan out or that offering. But remember, July 1 of this year, the state will expand Sooner Care, which is also Medicaid, and it will include a new adult category. So to find out more about that option, go to okhca.org.
Perfect. What about people with medical conditions? Can they still apply?
You're the perfect individual, because all ACA carriers cannot ask health questions during your application process, and they will not apply pre-existing condition waiting periods or blocks after you have coverage. So they take you as is. So ACA carriers cannot deny coverage due to your health, only by fraud or non-payment of premiums. So this is a come all event, come as you are.
That's great. So why would somebody want to buy coverage off the exchange?
This process will allow you to determine if you're eligible for premium assistance or subsidies. So most people are coming to the exchange to see how much premium relief they can get. And it could eliminate your premium or substantially reduce your premium. And it could eliminate your out-of-pocket expenses such as deductibles, co-insurance, and co-payments. So that is why most people will come to the exchange, which is healthcare.gov, to see how much premium assistance they can get and how much reduction in their out-of-pockets they'll get.
Can someone buy an ACA plan off the exchange through a carrier?
The COVID-19 relief SEP is offered by carriers on the exchange through healthcare.gov. The COVID-19 relief SEP is optional for carriers off the exchange. Note, when purchasing an ACA policy off the exchange, you are not eligible for premium assistance or subsidies, and you will pay the full premium and the full out-of-pocket expenses according to the plan you purchased.
Okay. If somebody already has an ACA exchange plan, but they want to make changes, can they still do it during this special enrollment period?
Yes, that's why it's another great point, and that's another reason why that we have this COVID-19 relief SEP. You can add, change, delete family members, change your income sources, or update your income. You can change to any metal level plan. You're not stuck in the same metal level, so you can move around, change carriers, whatever you want to do. Just keep in mind, if you change carriers, your accumulation does not follow you, does not transfer to the new carrier. So that is your deductibles and your max amount of pockets, they do not transfer to the new carrier. So keep that in mind. So if you want to stay with the same carrier but change to a different metal plan, then you can do that and retain your maximum out of pockets.
Can people use an agent or a broker to help them sign up?
Yes, they can. In fact, when you go to the home page for healthcare.gov, you can click on find local help, insert your zip code, and a list of agents that are qualified will show in your area, and then you can give them a call and ask for help at that time.
I think a big question a lot of people have is do they have to do they have to have a qualifying event? Do they have to document it?
That's the one good thing about this special SEP. They don't have to provide that documentation. They may ask you, but you don't have to provide or upload the documents.
Good. Can people buy other types of insurance during this SEP?
Yes, you can. There are other plans available that are not on the exchange and are not eligible for premium assistance. So, but you have to be aware that the non-ACA compliant health policies you just have to be aware of what you're buying. Understand and ask questions before you make that purchase. So like, for instance, short-term limited duration insurance plans are available. Fixed benefit plans like disease-specific plans, and hospital medical surgical plans, typically called indemnity plans, are available. All these types of plans that I mentioned are regulated by the insurance department and have consumer protections to them, just as well as the ACA plan. So if you have a claim situation that you're not able to resolve with the help of your agent or broker or the carrier, you can certainly file a complaint with the insurance department, and we will assist you in that process. So these are regulated plans that I have mentioned here.
So could you, if you don't mind, just real short, what is a short-term limited duration insurance plan?
Well, they will cover you for a certain period of time. Depending on the carrier, they will, they're not as broad as the ACA plans. They don't have preventive type services attached to them. They can ask medical questions. In fact, all of these plans, they can ask medical questions of you. They can medically underwrite based on your medical history. They can apply pre-existing condition or elimination riders.
Okay.
So they can have waiting periods before they will cover you, or they can just outright deny your application for coverage. So all these scenarios, even though their price points look good and their coverage sounds good, just be sure to ask many questions before you purchase this. If you are healthy, that drives a lot of people to these short-term limited duration or fixed benefit plans, but they are not comprehensive coverage. So just understand what you're purchasing.
So something that is not as talked about as much is healthcare sharing ministries. Can you kind of tell people what that is?
Well, healthcare sharing ministry plans are popular, but you have to remember these plans are not insurance and they're not regulated by the OID. So if you have a complaint, we can certainly listen to you, and but we don't have any regulation over these plans. So basically how they work is members make contributions to a dedicated savings account. So you can find several ministries that offer these plans, and they will ask you a series of questions. And basically, like I said, your contributions go into a dedicated savings account. The coverage and benefits are determined by the ministry, and coverage for medical expenses are not guaranteed and are covered by members' contributions once the bills are approved by the ministry. So again, this is not insurance. It's not regulated by OID, but many of these ministries have been around a long time. And as long as you understand what you're purchasing, then by all means, this is an option for you.
So going back to somebody goes to the exchange and they decide to add a plan. When does the coverage begin?
The coverage effective date is the first of the following after your application and confirmation. So for example, you apply on February 28th, your effective date would be March 1, assuming that you get your confirmation the same day. If you have any premium to pay, you will want to pay it at the time of the application or soon thereafter. Some of the information that I would like to share with you are the carriers. These are the same carriers and the same plans that were offered during the fall 2020 open enrollment for coverage effective dates starting January 1. So you're going to see the same carriers, Blue Cross and Blue Shield and Medica, in all 77 counties. You're going to see Bright Health, Community Care, Oscar Health, and United Healthcare offered in selected counties. Sometimes they're going to be around the metropolitan areas, either Tulsa, Oklahoma City. So you'll see all of their plan offerings as well. And when you enroll during any SEP, this one or in a future SEP, you will have to reapply during the fall open enrollment of 2021 to continue coverage in 2022. So you'll have coverage during this SEP, first of the following month after application. You continue making your premium payments. You'll have coverage as long as you keep making those premium payments until December 31st of 2021.
Okay. Well, anything that you think that we have not covered that you want to add in?
No, I think this is just plain and simple. If you want coverage, now's your time to do it. It's come all. We don't, they're not going to ask you health questions. So
I do see, certainly if anybody has any questions, please put it in chat. I did get one question asking if we would be recording, sharing a transcript of this. After this is over, we will send out a link with to watch the recording. And so we will send that to anybody that is registered as a participant. So we will send that out shortly to, after today. Did we get any other questions, Ophelia?
I didn't see any questions come in, but if you do, you can always contact the Oklahoma Insurance Department.
Yeah,
I
did. I'm sorry if you mentioned this and I missed it, but is this a highly unusual thing to be offered during this time of year?
yes, it is. Generally, SEPs are open to any individual who has lost their health coverage or has had a life event, such as death, a birth of a child, etc. And that SEP is usually for 60 days beginning from the date of the event. So, and that's a rolling SEP according to the individual based on loss of coverage. So this one is a special event. It's due to the COVID-19 pandemic and the loss of many jobs and businesses closing. Or, if people have always wanted health insurance, didn't have the opportunity through their employer or whatever circumstances, you can apply now during this special enrollment period. It is for 3 months, and that's, again, an unusual time frame. But just as a statistical point, Oklahoma has the second highest uninsured population following Texas. So there's good reason for Oklahomans to purchase individual health insurance and see how much of it is going to be paid by the federal government in subsidies.
And this would apply for people that are employed but do not have insurance, correct?
Right. If they're not eligible for insurance or maybe their employer is not offering group health insurance. There are several companies that have gotten in, are doing that. So this is an opportunity for them to come on board.
So I've added to the chat a link to the Oklahoma Insurance Department for this information. So if you guys want to share that with friends, family who are in this situation, then that would, that'd be helpful. Spread the word.
Okay. All right. Well, certainly. Thank you guys. And Rebecca, thank you for your time and your expertise. We appreciate it. And I will sign us off.
I'm glad you had me. Thank you.
All righty. Thank you. Bye-bye.
Bye.